TF-CBT and Multicultural Feminist Therapy. Yasmin is a Spanish-speaking 14-year-old immigrant female student from Guatemala. She migrated to the United States with her father and older brother, leaving behind her mother and 4 younger siblings. Their migration was due to the discovery that Yasmin was sexually abused by her paternal uncle since the age of 11. She was threatened by her uncle about disclosing the abuse, and once the abuse was made aware to her family, her uncle threatened to hurt her. Therefore, fleeing the country was the only option her family felt they had. Yasmin states that she often feels unsafe at home and mistrusts males. She reported pain in her chest and abdomen whenever she recalls the abuse. She has trouble focusing at school, often feeling unsafe, dizzy, and has severe anxiousness in class. Yasmin was referred to school social worker due to disclosure that she has had traumatic experiences in home country to teach her. Yasmin hopes to ease symptoms and to be able to talk about how she feels with others. The evidence-based practice model that will be used to treat Yasmin is trauma cognitive behavior therapy, or also known as TF-CBT. The goals of TF-CBT are to guide children and youth who have experienced serious traumatic events and their supportive caregivers. 1. To learn effective skills to cope with trauma-related emotional and behavioral problems. 2. To face and resolve those problems in a safe and therapeutic way. And 3. To effectively integrate their trauma experiences and help them move on with their lives in a safe and positive manner. This EBP was chosen since TF-CBT has been proven to work well with children who have undergone traumatic experiences and is respectful to cultural values. The intersectionality lens theory that will be used to guide the practitioner with Yasmin is Multicultural Feminist Therapy, which centralizes the intersections of oppression, power, and privilege in the lives of self-identified women with an understanding of the quest for social justice as an integral component of wellness. This theory has 7 tenets, which are egalitarian relationships, self-definition, cultural congruence, social-political consciousness in the form of intersectional awareness, empowerment, community support, or interpersonal connection, and lastly, growth and thriving. This theory was chosen because it acknowledges the existence and impact of oppression as a potential form of societal and intergenerational trauma, which is appropriate to analyze with Yasmin's presenting problem. TF-CBT does not necessarily address engagement during the treatment process, although the therapist does start off with some psychoeducation and introducing coping skills before diving into the trauma narrative. This further promotes wellness and relationship with therapists by finding ways to bond and trust. In multicultural feminist therapy, it is addressed that rapport building with adolescent girls of color requires appreciating and respecting diverse family structure, which may use humor, proverbs, and communication to engage with clients. Difficulties that may arise is that TF-CBT requires that a caregiver be involved, and sexual assault might be difficult to discuss with a male parent. Yasmin has also expressed a tough relationship with her father, which may interfere with Yasmin's capability to begin services. TF-CBT is broken down into 3 phases: the stabilization phase, the trauma narrative phase, and the integration/consolidation phase, meanwhile focusing on gradual exposure and parenting skills throughout the sessions. In multicultural feminist therapy, the interventions used are empowering narrative therapy, holistic awareness, and expressive arts. Combining TF-CBT and multicultural feminist therapy, Yasmin will be able to utilize both. For example, singing a song for trauma narration. Potential diagnoses that the practitioner might diagnose Yasmin with are acute stress disorder, adjustment disorder, or post-traumatic stress disorder. Due to Yasmin's specific experience with the traumatic event of repetitive sexual assault and symptoms, the practitioner might lean towards a PTSD diagnosis. Yasmin's treatment plan based on TF-CBT and multicultural feminist therapy is having short-term goals of gradual exposure and trauma narrative and processing, which Yasmin will be able to affirm and address Yasmin's feelings of her trauma. The long-term goal will be for Yasmin to have an empowerment of self and have a sense of control to her narrative. TF-CBT and multicultural feminist therapy does not necessarily have guidelines for termination. Although once Yasmin is able to reduce her symptoms by gradual exposure and have conjoined sessions with her father, Yasmin will be able to complete her services or may continue to receive services for other personal goals. If Yasmin were to choose to terminate services, the practitioner may do an activity where Yasmin enhances her safety, such as painting a portrait of her support system. This uses both TF-CBT and multicultural therapy as a form of expressive arts. Since Yasmin does not have any maternal figures in this country, the practitioner may guide Yasmin to identify some women individuals that can provide support. Yasmin and the practitioner have many different identities, where the practitioner holds power and privilege towards Yasmin. The practitioner is a US-born person and does not have to go through acculturation, which can be difficult for Yasmin to experience. For example, the practitioner has knowledge about psychoeducation and treatment of trauma, whereas Yasmin has been told not to discuss her trauma with others. If the practitioner does not consider this, it may interfere for Yasmin to understand the process of TF-CBT. Therefore, it will be important for the practitioner to provide psychoeducation and be culturally aware of Yasmin's challenges of having trouble to talk about her trauma. The practitioner can use multicultural feminist therapy perspective of A. Ongoing self-examination, B. Sharing power, C. Giving voice, D. Facilitating consciousness raising, E. Building on strengths, and F. Leaving clients the tools to work towards social change. Clients are experts to their own lives, and practitioners are collaborators that guide the client. Potential transference issues that might come up to Yasmin are that she might have feelings of unable to move on without the guidance of the practitioner. Yasmin might build an unhealthy attachment with the practitioner since she does not have any maternal figures in the United States. Yasmin might feel that she cannot use coping strategies on her own, thus preventing her from utilizing skills learned in TF-CBT. Also, when terminating, Yasmin might have feelings of abandonment and may have feelings of resentment towards the practitioner. Countertransference that might occur to the practitioner are that the practitioner might feel overprotective with Yasmin. She might feel resentment towards her father and have beliefs that she can be a better parent. This will impact TF-CBT process of conjoint parent-child sessions. The practitioner might also want to rescue client from having to relive traumatic experience, which in result will interfere with the TF-CBT process. Overall, it will be important for the practitioner to be aware of this and discuss with the client how to maintain healthy boundaries that will allow them to build a healthy client-practitioner relationship. Thank you for watching this video. Please like and subscribe.